You may not know this, but millions of families have been fighting tooth decay for decades by simply turning on their taps. That's because 74% of people whose homes are connected to a public water system receive fluoridated water, which is proven to fight tooth decay and improve oral health. Community water fluoridation is nothing new. In fact, it's been around for more than 60 years. Nearly 200 million people drink and cook with fluoridated water every day. Fluoride occurs naturally in most drinking water, and at certain levels, fluoride can stop or even reverse the tooth decay process. Because water fluoridation is effective and inexpensive, it's no surprise the Centers for Disease Control named water fluoridation one of the 10 great public health interventions of the 20th century. And it's not just the CDC either. The American Academy of Pediatrics, the American Dental Association, the American Medical Association, the World Health Organization, the Institute of Medicine, and many more recognize the health benefits of community water fluoridation. In fact, more than 3,000 high-quality scientific studies and research papers also conclude fluoridation as a safe, effective public health practice. So what is fluoridation and how does it work? Chief Science Officer Dr. Jed Jacobson explains.
Fluoride exists naturally in nearly all water supplies, but usually at levels too low to prevent tooth decay. Fluoridation is the practice of adjusting the fluoride concentration to a level that will reduce tooth decay and promote oral health. In a nutshell, fluoride helps remineralize the surface of your teeth and prevents cavities from continuing to form.
While drinking fluoridated water is a no-brainer for good oral health, fluoridation is not a magic bullet by itself. It's important to brush, floss, eat healthy, and visit your dentist regularly.
Ladies and gentlemen, please welcome Kathy Latourie, Chair of the Oral Health Section.
Sorry, I had to move the box. Good afternoon. It's truly a pleasure to be here to celebrate the 70th anniversary of Community Water Fluoridation right here in Chicago, a city that actually authorized fluoridation 61 years ago. And interestingly enough, one of the first trials was right here in the 1940s with Evanston and Oak Park, and the outcome demonstrated then, and as we continue to recognize now, is fluoridation works. And it's truly an honor to represent the Oral Health Section and to recognize APHA's steadfast support of fluoridation, with 19 resolutions passed since 1950 as a safe and effective and cost-saving public health measure for the prevention of a disease that affects almost every one of us. Fluoridation gives all of us, including the most high-risk populations, a chance for better oral health, a chance for all of us to become part of the healthiest nation in one generation. The CDC recognized it as one of the 10 great public health achievements of the 20th century, and it's been a healthy people objective since 1990. Today, more than 210 million people living on public water supplies in the U.S. live in fluoridated communities, and the goal for Healthy People 2020 is to reach 80%. Why is fluoridation so important to all of us? Because oral health matters. It's essential for our well-being and overall health. Dental disease affects almost all of us, regardless of age. Tooth decay is the most common chronic childhood disease. Dental disease may affect our ability to eat, to chew, to speak clearly or with confidence, to work, to learn, to be productive, and to socialize and simply be healthy. Dental disease can impact the well-being of people living with chronic conditions such as diabetes. And although tooth decay is preventable, It takes a range of efforts at the individual, family, and community level to prevent it. Unfortunately, access to dental care is not a reality for many American adults. The Affordable Care Act does not include a dental benefit for adults, and approximately 40% of American adults do not have dental insurance. And most adults who rely on Medicare or Medicaid do not receive much in the way of dental benefits. Drinking fluoridated water levels the playing field, increases health equity. It works systemically and topically. It's the most cost-effective public health strategy that we have, and one that actually saves money. For every $38 spent, we save $38 for every $1 invested by larger communities. For more than 40 years, I've worked as an oral health professional, with most of my career spent at Children's Hospital in Boston or at Boston University, where I direct the dental school's outreach efforts in the community. I've seen firsthand the benefits of fluoridation in children and adults, and I've seen firsthand the consequences of lack of fluoridation and lack of access to care. On a personal note, I did not grow up in a fluoridated city, and I have the fillings to prove it, but I made a point to raise my children in one, and they are cavity-free adults today. All of us, as public health professionals, irrespective of our discipline, should help to educate our target populations and communities about fluoridation and be ready to promote it and defend it as necessary. Unfortunately, every day, thousands of people are confused by misleading information on the internet and social media. A recent study showed that the leading anti-fluoridation website had 5 to 60 times more traffic than the 2 leading pro-fluoridation websites. Pro-fluoridation health organizations, the CDC and the American Dental Association. Imagine 5 to 60 times more negative traffic. It's not easy, even for the well-educated, to sort out all the misinformation in opposition to well-established public health measures and policies. This is an important message for all of us. 2 years ago, I was blindsided when one person in my town got a Stop Fluoridation initiative on the ballot with simply obtaining 10 signatures. We've become too complacent and need to have a better presence on the internet and social media to better educate the public and keep the public informed. I have 3 recommendations. 1, every local, state health department and every health provider organization should have credible information about fluoridation on their websites. 2, every school of public health and schools of nursing, dentistry, medicine, and social work should provide credible information to their students, their faculty, their staff, as well as on their websites. And 3, all of us should educate our neighbors, our community leaders, and our policymakers about the benefits of fluoridation. In closing, as I think about this year's theme, health in all policies, I challenge you to act and include community water fluoridation in all health policies, as well as health in all policies. Please join us tomorrow for a special session, Fluoridation, a 70-year success story, with experts from the CDC, Pew, the American Dental Association, and the University of Maryland School of Public Health, and moderated by an APHA past president. And lastly, I want to thank all of you who work hard every day to promote the benefits of fluoridation. You know who you are. Please stand up. Let's have a round of applause. Thank you. Love to see everyone standing next year. Happy anniversary, Community Water Fluoridation.